Good afternoon, everyone, and really very excited to have all of you join this very exciting panel. As you all know, that COVID has really impacted women and girls disproportionately. Unfortunately, it's also been a year that as researchers, we've not been able to access the field as much. And we've had to rely on remote data collection methods, particularly using phone surveys. So today we have a very exciting lineup of speakers who have been working particularly on collecting data remotely from the field from women and girls. And today what we've asked them to do is present to you the challenges and the barriers that they face, particularly in collecting data from women and girls. As many of you who would have joined the session know that it's more challenging to speak to women and girls because of their digital access issues, issues with digital literacy, also the fact that you can't ensure privacy at all times when you're calling them. And we just asked the speakers who've joined today to share their experiences, particularly in terms of both research design as well as implementation and what can be done better. Because as we know, maybe the next 1 year, the field might look like this. So, and this is the time that we really need more evidence from the field to be able to actually design more gender responsive policies and programs. So I'm just going to start with some housekeeping rules. Firstly, this event is being recorded and it will be posted on the global website as well as on the IWage website. I hope that's not an issue for people. It's in a webinar mode, so there's a Q&A option that you would all see. If you have any questions at any time while the speaker is speaking, please do type it out in the Q&A chat box. And if they have the time after they've spoken, they can respond to you live. There is also, we have a fixed hour, and so we will try and wrap up all the presentations by 12:40. I've asked the speakers to stick to their time limit of about 10 minutes so that you can, we have about 20 minutes for questions. In the chat box, we're just going to put some hashtags. If some of you are on social media and would like to tweet about these events, or even the findings that or insights that you're getting from the speakers' presentations, please feel free to do so and use those hashtags. So just before we start, an introduction for all the speakers. As I said, we have a stellar lineup, particularly those who've been working over the past year on phone surveys. Divya Nair is a director at ID Insight, and she leads learning partnerships in agriculture, financial inclusion, sanitation, and nutrition. Currently, she's also leading ID Insight's COVID response team in India, as well as capacity building work to support officials at a range of levels so that you can use data for better decision making, particularly for the Poshan Abhiyan in India. Prior to ID Insight, Divya worked with several development organizations, including World Bank in Washington, and held consultant positions with IFAD in Rome and the Institute for Health Policy in Colombo. She holds a doctorate in public health from Johns Hopkins and also an MBA from Princeton's Public Policy School and a bachelor's degree from LSR. So welcome, Divya. I know this is a very passionate subject for you and really glad to have you. We then have with us Kalyat Amusanya. She's a research manager at IWage itself. She has trained in the fields of anthropology and sociology. Amu has extensive experience in conducting research both in India and the UK, and her expertise and interests include rural development, collective action, social accountability, and even urban sociology. And she basically is very excited about applying evaluation from a very anthropological lens. And prior to joining IWage, she was working at the University of Brighton, the London International Development Centre, INTAC, and UNICEF, among other organizations. Thanks, Amu, for joining us. Also very excited to have Musna Alvi, who's the research fellow in the Environment and Production Technology Division of IFPRI in Delhi. Musna has been overseeing gender phone surveys in India and in Nepal, focused on COVID impacts, in addition to phone-based extension interventions and RCTs in the two countries. She's also led various research and evaluation projects in South Asia focused on agriculture advisory, extension systems, balanced nutrition application, integrated pest management, and input subsidy and mechanization. She has extensive experience, particularly on working with women's self-help groups and on collective action. She's previously worked with the World Bank, the Planning Commission of India, and GIZ. She has a PhD and MA in economics from Michigan State University and an MPhil in economics from JNU. Welcome, Muzna. Really excited to have you join us. And finally, last but not the least, we have Vineet Bhandari, who's an associate partner at Dalberg. He's based in Dalberg's Mumbai office. Much of his work has been at the intersection of gender, financial inclusion, and agriculture. And he's led several large-scale projects that blend mixed methods, research, including industry consultations, dialogue, large-scale data collection, and other consulting approaches. But most recently, Vineet was leading one of the largest surveys in India to understand the gendered impact of the pandemic. This involved running a large-scale sample of 17,000 households in the country. The objective of the survey is to understand the impact across several dimensions, the impact of the pandemic on health, nutrition, employment, debt and assets, and particularly shift in gendered norms and perceptions. He has an MBA from the Indian School of Business with a double major in finance and marketing, and he's also an engineer from IIT Madras. So Vineet, really hearty welcome, and we look forward to hearing findings from the Dalberg survey. With that, I'll just hand it over to Divya. And Divya, over to you. And basically, it'll be really nice if you can talk about even the measurement biases that you thought and all the exciting work that IT Insight has done that you thought were coming up, particularly when it comes to interviewing women remotely.
Great. Thank you, Soumya, for this very generous introduction and invitation. Really looking forward to a good conversation on this panel. Excited to continue working with you on this topic. So just to kind of give you some background, ID Insight has been conducting a large number of surveys during the pandemic using phones. I'm going to be talking about, specifically what that experience has been when we're reaching out to women. We have been using our data on demand infrastructure. So basically, this is this infrastructure where we have more than 1,000 surveyors spread across the country who we manage, train, and then we have systems in place where we're able to ensure that the quality of the data that comes in is really checked in real time. And basically, given that we have a relationship with these surveyors, we're able to kind of build rapport with our surveyors. And I'll talk about, the importance of that going forward. So next slide, please. In terms of today's presentation, I'll be talking about 8 phone surveys that we conducted over the last year or so. All of these were targeting women. All of them were mostly in rural India. So it was, for 5 of these surveys, we were looking at both men and women. So in some of them, we were agnostic in terms of who picked up the phone, and we did want to get women. But if the woman didn't respond, we kind of continued with the male. And I'll talk a little bit about, what that setup looked like. And then there are 3 surveys where we specifically focused on getting, women to answer the phone. The topics that we covered across these surveys were related to COVID knowledge, attitudes, practices, access to public services, relief. And then we also had questions on, specifically for the surveys where we were looking at, women in self-help groups or women in social enterprises with iWage and Imago and Seva Bharat. Then we had more specific questions about, the experience of these women in these as part of these larger, initiatives. In terms of where we got the phone numbers, and that becomes quite important going forward, is that for all the surveys that we conducted, we had basically collected a lot of the phone numbers in person. In fact, for 6 of the surveys, we had already touched base with these households in the past. And these were panel households. So we had, talked to various members about different topics. And so even in terms of, again, going forward, exclusion criteria and all, we already knew who these households were that we were going to be missing. Whereas for 2 of these surveys, we got the phone numbers from the implementing partners. So this was, often coming from administrative data, or it was coming from, NGOs who were working with these women. So it was a list of phone numbers that they gave us, and then we called them. Next slide, please. So I feel like this is one of the most important slides in my deck, is that it gives you a sense of, male gatekeeping. Basically, when you call a household, 70% of the time, a man will pick up the phone. And so the question is, how do you get to the woman? And I'll talk about strategies to do that. But this number, it kind of triangulates across surveys, and other institutions also have found that this is the challenge. That and often, can you next slide, please? Next box. Is that when you ask a man or a woman to pass the phone, only 10% of the time are they willing to pass the phone. So, regardless of gender, only 10% of the time is a person willing to pass the phone when you cold call them. So, and the reason is not necessarily that they don't want you to talk to the other person. It's often that, they're not co-located. The man has the phone, they're sitting in the field or sitting in a shop, and, it's the household phone that is being shared by members of the household. And so what this means is that if you just call a household, like cold call them, our response rate was only around 23 to 30%. That's the next box. And so, when you've got this very low response rate, the question is, how do you get beyond this? And who are the women you're missing? How do you kind of bypass the male gatekeeper, or, kind of allow the male, kind of work with the male gatekeeper to get to the female respondent? And next slide. So I just want to kind of underline that the 70% number has come from other work too. EPOD did a literature review, and they also found that the number was that 70%, 71% of men own the phone. This is ownership, and 38% of women own phones in India. This was an all India study. And then, as I said, access becomes difficult because of shared phones. Next slide, please. And so the other question that we kind of dug into is, within the same household, what does use look like? And what we're seeing here is, again, that 73% of men are using the phone daily, as compared to just less than half of women who are using the phone daily. And a third of women are using phones only for emergencies. We looked at this also by like number of phones in the household, and actually it didn't make much of a difference. So, even if there were more phones in the household, this kind of disparity continued. And the change was quite marginal. So it's almost like it's an attitudinal problem, in the sense that women just don't access phones regularly. Next slide. And so these were, so broadly we'd categorize our approach to reaching households into these two categories, which is the light gender targeting, where we call a household, where, a priori, we designate households into male and female target households. And basically we want like a 50-50% split. If we reach a female target household, then when the man picks up, we ask for the female. And we try to kind of call back and get a woman, but it's still light touch. So if the man kind of refuses, we continue the call with the man, and that's when we got to that number that I showed you earlier. Whereas the more proactive appointments, when we use this strategy, then we were able to really bump up our response rates and reach for women. So, we had a lot of success in terms of making appointments a priori. Basically, you call a household and you say that, we want to talk to the woman, and can we call back? And then we were able to access more women. Next slide. And so these were the numbers. Basically, the number jumped up to around 43% female response rates when we had these appointments made a priori. And then, for example, when we were focused on pregnant women, or in the case of, when we're looking only at, women in self-help groups, etc., we were able to reach our target population with these appointments. When we're talking about appointments, I'd like to mention that, you do need to continue calling the household. So what we found with, the team has found over time is that we call back a household around 7 times. And we call households, the other learning is we call them over, a week or over a period of time. You don't want to keep calling them on the same day. And also the timing of the call matters, because again, women are busy at a particular time of the day. So basically in India, what we found is evenings are not the best, whereas like afternoons are somewhat better. It also depends on the season. For example, agricultural seasonality, if women are in the field at a particular time. So you have to kind of take that into account. Next slide. The other finding was that we were able to get higher consent rates when we had female surveyors. And basically for the survey that we did with pregnant women, we would, getting double the consent rate compared to men to talk to women for our surveys. Next, please. And basically, this is something that we can discuss, but there are challenges in the sense it's not easy to find female surveyors. Often the female surveyors also have their constraints in terms of the timings when they are available to make these calls. So you do have to kind of work within the constraints of that, but we do think, and we've really kind of appreciated the returns in the sense that it really is useful to have more female surveyors in the survey industry in general. And next, please. And the other thing is just generally male or female. I want to underline the importance of training in general across all surveys, phone surveys, but specifically what we found with the iWage survey, in fact, was that gender sensitivity training was really useful. So, talking to both men and female surveyors, male and female surveyors about, not like what kind of language to use, not forcing, not using forceful language, being kind of understanding of the context of the respondent, all that was very useful. And that, builds into this kind of building trust is very important, and making connections. So again, this kind of comes through during training. Um, Again, when you're talking about like getting access to the woman, there are some ways in which you can get access easier, is that if you kind of connect to where you got the phone number from. If you got this phone number from somebody who they trust, then they're more willing to answer and respond to questions. Next slide, please. And so, there's a lot more that, to keep in mind, but I'm assuming that the fellow panelists will cover it. But I just wanted to touch on a few of these. As I said, the context of the respondent is very important. There has been some really good work in terms of age of the respondent. In fact, the adolescent girls, for example, the biggest gap in terms of access to phones is actually during adolescence. In terms of adolescent boys have a lot of access, whereas adolescent girls have the least access. So that's something to keep in mind. As I said, timing of call is important. Privacy, I think, and Muzna will probably cover it. Her paper is really useful on that. And we often ask if a respondent is on a speaker phone, and just to kind of understand the context of the respondent. Generally, keeping the questionnaire short is important. And then I think we'll talk more about sensitive questions. Excuse me. And the other thing is, in terms of when you're asking questions, it's important to understand: are you asking the question about the individual or about the household? Going back to the point I made earlier, is sometimes we were agnostic if it was a male or a female responding. But I would underline, there's a lot of research saying that you get different responses about a household depending on who's responding, whether it's a male or a female. During the COVID surveys, we found, for example, even prices, men and women answered that the price of a particular product was different according to whether it was a man or a woman. And there's been a lot of innovation around this in terms of how to measure women's work. But I don't think that's specific to phone surveys, but I think researchers should keep that in mind. And finally, one last point I do want to make is ID Insight is increasingly trying to share back the results to the respondents. This is not female specific. But I think, it's something to keep in mind is that what we are thinking of is, just a very simple one pager with what did we find, so that we can kind of give back to these women who are very busy, and kind of, provide them potentially with information that they can use to understand, contextualize their own lives. So I'll stop here. Thank you.
Thanks so much, Divya. It was really fascinating, and also particularly on how you structured the calls and the trainings. And I know that there's been a lot of emphasis on ID Insight to actually check quality on how the data is coming back. So more in the Q&A round, but over to Amu. And Amu, it would be great if you can share your insights from the lead and iWait surveys.
Thank you, Soumya. And a very good morning, afternoon, and evening to everyone. It's really a pleasure to be here. Over the last 18 months or so, a lot of the organizations, especially organizations doing research, have had to pivot to digital modes, phone-based modes of data collection. While necessary, this shift has not always been easy, and there have been sharp learning curves in what we are doing, responding to challenges and barriers of this type of data collection. Uh, and while I'd like to preface what I'm saying in the next few slides by saying that while I am focusing on challenges and barriers and how we might mitigate these challenges and barriers, this is not to say that the phone-based method in itself or the digital method in itself is invalid. It is arguably the only way that we could collect data in this pandemic. However, it does come with a lot of challenges that we have had to very spontaneously contend with. A lot of things that I'm speaking about would be also common to what Divya said, but also common to a lot of us as practitioners and researchers are contending with these challenges on a day-to-day basis. But they do get in some ways relegated to limitation sections of reports. And what would be good for us to actively engage with the challenges that we are facing as practitioners and researchers, and to continually see, as Soumya said right in the beginning, we are looking at a time frame where this is going to continue for a while. And how can we as a community of researchers find solutions for the types of challenges that we are seeing? Next slide, please. Over the last 1.5 years, iWage and our parent organization, Lead at Korea University, have conducted various studies that have the remote method of data collection. These have used mixed methods. There have been qualitative interviews, in-depth interviews, quantitative surveys, virtual focus group discussions, and the digital mode has adapted itself to actually give to all these mixed methods of data collection. The studies that we have conducted, a large number of them have been on the impact of COVID and the ways that these are affecting women's lives. But also we have conducted evaluations of schemes and programs that have not had any COVID-based inquiries within them, but have used the remote mode of data collection because that was the only way to collect primary data. What we did find across the studies was that the field was changing very, very fast. It was extremely dynamic. So data that was collected today may not hold relevant even 4 weeks down the line or 6 weeks down the line. Things were changing very fast. So the needs of evidence generation and then the needs of this very fast changing scenario on the field with lockdowns being imposed, lockdowns being lifted, was something that was we had to balance as we went along. Things changed even within the period of data collection. That being said, it has also afforded, especially our organization, it has afforded us a lot of possibilities. Currently, iWage is doing a study with different South Asian countries, and this would have not been possible. It would have been extremely expensive, time intensive if physical modes of data collection were to be put in place. However, as remote modes of data collection have become the norm over the last 18 months, iWage itself has been able to scale up the kind of work it's doing in a constricted time frame. Remote methods, of course, have a lot of advantages in terms of cost efficiency, time efficiency, being more environmentally friendly. However, one needs to really think about the population one is trying to draw information from if remote methods of data collection are being used. Next slide, please. So having very briefly touched upon what are the positives of this mode of data collection, there are definitely concerns for practice and measurement. And for us, for iWage and for LEAD, a lot of that had to do with sampling. We are only, like Divya said, that a lot they had collected phone numbers prior to this becoming digital modes. This was not the norm in iWage and LEAD studies. We were collecting phone numbers from administrative lists that were already available in MIS systems, which restricted us to talking to women who either had a phone or had access to a phone within the house. For a lot of work that we do, this is extremely restricting because we do work with a lot of women from vulnerable and marginalized backgrounds who do not have access to a phone. And these are voices that we are missing out on. These are voices that we are not being able to capture, especially when we're talking about the impact of COVID. These are voices that become extremely important. There were methods in which we tried to mitigate this issue. For example, if there were locally placed project staff, there were instances in which the project staff phone was used for either interviews or for focus group discussions. But this came with its own set of challenges. The solution itself had challenges in terms of women being able to speak freely if there was a staff present, even if they couldn't hear, even if the staff was just present in the physical environment, and because they were using their phone, what would be the freedom with which women would have responded. Another set of concerns was on non-response, low response, and extreme response. Even with protocols in place of calling women multiple times over about 6 days, having detailed consent forms, having detailed information about the study, calling women when convenient to them, putting in time, appointments, getting appointments. We still see between LEAD and iWage that we did not get a response rate of over about 60%. We did find that while we were doing evaluations for government programs, we did have a marginally higher response rate, but major challenges really were invalid numbers, wrong numbers, lack of connectivity, which could probably be mitigated by having updated MIS systems. But for the kind of work we have done, invalid and wrong numbers were a massive challenge. An interpersonal challenge for response really would be trust and privacy. We are talking to women who have never seen the surveyors, are not familiar with the surveyors, and there is questions of trust, especially if you're asking sensitive information, personal data. That the lack of familiarity does impede the way women would respond. In a study that we conducted in Orissa, we tried to mitigate this particular challenge by using counselors that were already staffed at gender resource centers and who had initial familiarity with the women that we were going to be talking about. But again, the same challenges come up as if you were using project-based staff. And you have to correct for the familiarity, the women already knowing the interviewer who they are going to be talking to. With extreme response, we found that even though we were very, very detailed in our talking about the research in itself, saying that this was not going to lead to direct benefits. But because we were talking about entitlements, we were talking about schemes, we were talking about the support that women may or may not have received, there was, in a lot of studies, while we were discussing once the data was in, that there might have been a respondent bias that if we answer in a particular way, then we might be getting access to certain benefits. And this is something that we would really, at the design phase itself, see how we can ask questions that does not lead to this kind of bias. And time has been
just 3 minutes.
Okay, fine. So time, I think a lot of people have spoken about. So depth and breadth, prioritizing what you need to talk about. Translations and training, there's been trainings that I've already spoken about. I just want to very quickly talk about translation and language. Language is what is mediating what we are saying. In an atmosphere where you don't have observation, you cannot actually see what is happening on the field. Language becomes very important. You have to use locally relevant vocabulary so that the answers that you questions that you are asking are understood correctly, and the answers that you are getting are relevant to the inquiries you are making. Next slide, please. I'll very quickly go through these considerations, because everything that we have talked about in the earlier slide really were considerations for data and research. These have to be balanced with the needs of women and what they are going through currently, especially in these extremely distressing times. Mental health has been a major concern. Like a lot of marginalized populations, women are also dealing with income loss, livelihood loss, food insecurity, and this has an impact on stress and anxiety, has an impact on recall and accurate recall. And in a lot of the studies that we are talking about, we are asking women to talk about periods of time that have already passed. In a study that was conducted by Lead at Kriya, they had questions they asked that could have been answered in intervals as well as in relative scales, reducing the cognitive pressures on women, because they didn't have to quantify everything that they were feeling or having to say, even in terms of hours of work. Empathy is another thing that has been challenged, especially while we are talking over the phone. We're not able to empathize or comfort women who are going through distressing times. In studies we have conducted, we have tried to make sure that we have listed services and helplines ready that we can give to women. Services in terms of even government helplines that could connect them to PDS and take home ration to elevate rural distress, and helplines for emotional support. Finally, I just would like to say that we need to keep in mind all women's needs and concerns, and we are missing out on a lot of voices because of the kinds of methods we are using. And if we as a community need to think of other ways in which we can collect data in this time where these voices are brought to the table and we can build back better. Thank you.
Thanks so much, Abu. And I know that you brought up a very relevant point, that the digital mode of data collection might be here to stay. It's easily done, it's more accessible, and therefore this becomes much more relevant in how do you access women who might not have these modes that are readily available. Would like to invite Musna now to share her findings, and Musna, really looking forward to seeing your assessments and how to address the privacy issues as well. Over to you.
Yeah, thank you. Thank you so much, Samia. I'm really excited to be part of this stellar panel and to share our findings from COVID phone surveys that we've been doing in the region. I'm drawing primarily from my experience of doing surveys in India and Nepal, which I led directly, but I will also draw insights from surveys that IFPRI has been doing with women in 6 countries in Africa under the Gender, Climate and Nutrition Initiative, or GCAN, of which I'm also a part. We are supported by BMZ in India and by USAID through GCAN in Nepal. A quick background on our survey in India and Nepal. In India, we surveyed 9 districts, women from 9 districts in Gujarat. These were all women who were members of the Self-Employed Women's Association, or SEWA. SEWA recruited our respondents beforehand, so they called up their members, said that they should expect, or whether they agreed to participate in a survey or not, and that they should expect a phone call from us. And they gave us a master list of respondents from which we randomly sampled close to 600 plus respondents. Our first survey was done, oh, I'm sorry, I should have said, next slide. So our first survey was done in between May to June of 2020. And we surveyed, and we've been tracking the same women over time. So the 5th and final round will be done later this month. So we would have tracked the same women for over a year now. Next slide, please. Our survey in Nepal was building on a in-person listing exercise that we did in February of 2020, and this was done in Dang district in province 5. It's an area bordering India in the western part of Nepal. The listing was done for what was supposed to be an in-person video-based extension RCT. When COVID happened, we had to quickly modify our research design to make this a phone-based extension RCT, looking at the impact of phone-based extension on integrated pest management practices. So we had 2 treatment arms and a control arm, and the control arm is what ultimately became the sample for our GCAN gender survey. So this is a survey primarily of agriculture decision makers, and 70% of our sample was women. This is an area, like I said, borders India, so sees a lot of male out migration to India, and a lot of women are de facto heads of households. So we had close to 800 respondents, and similar to the survey in India, we are going to be tracking these same women for over a year. So the 5th and final round is scheduled to be done in July of 2021. So what are, next please, yeah. What are some of the basic conditions that should ideally be met for phone surveys to be a replacement for face-to-face surveys? And these are some aspects we don't have control over. So enough, as researchers, we don't have control over. Enough women should own or have access to phones, and there should be no systematic bias in who owns and does not own a phone. We know that that's not true. Cell phone networks should be reliable. We can control that on the enumerator front, but can't control that on the front of respondents. Enumerators need to be trained in using phone surveys and in asking nuanced questions over the phone. You know, a lot of times enumerators respond to facial and visual cues when doing face-to-face surveys, and when to not press for an answer, when to stop, to kind of gauge what is happening in the background, and when it is okay to ask certain questions and not. We can't do that over the phone, so it's very important to train enumerators to be sensitive to these things. And then we need to ensure respondent privacy, and I'll talk a bit more in detail in the subsequent slides. This image gives you a snapshot of the gender divide in phone ownership everyone has spoken about. It's really clear that South Asia has the highest gender gap. But in India, I want to also sort of press that this divide doesn't just end at gender. There are important intersectionalities to consider as well. We know from previous household survey data, including the national sample survey data, that disadvantaged ethnic groups, the Dalits, tribals, Muslims, and women and children, especially from these groups, are less likely to have access to mobiles or computer technology, making everything from access to information and access to online and remote learning, for example, a challenge. And this also means that when we are doing phone surveys, we are also not able to adequately reach people from these disadvantaged groups, especially women from these disadvantaged groups. So there is multiple layers of deprivation and sort of disconnect to account for. Next slide, please. Next, please. Thanks. So lack of access to phone limits women, oh, no, the previous slide. Thanks. So lack of access to phone limits women from being able to access a host of targeted services and more generally information. And this is becoming even bigger challenge in the current context where physical interactions were suddenly disrupted, but the need for access to reliable and timely information on health and livelihoods was heightened. So from our experience on the more micro side is the issue of intra-household disparity and phone access. So several people have spoken about it, about women who had given their husbands or sons phone numbers. It was harder to get women on the phone. In India, between the time that SEVA collected phone numbers from their members, these were their phone numbers that were phones that were owned by the women SEVA members. And till the time we were able to start the survey, which was not a very long gap, several phone numbers became inactive. And this was very puzzling to us, that why phone numbers should become inactive in such a short period. And on investigating some more, SEVA found out that because of cash crunch due to lockdown, it was often women's phones that were the first to be cut from the household budget, causing them to become inactive, and they were considered quote unquote unnecessary expenditure. And those are some of the issues that sort of unequal phone access throws up. There is unfortunately little we can do purely as researchers in terms of improving access, but from a research point of view, it's important to acknowledge the sample from which we are obtaining our information is missing out on the most disadvantaged women and may not necessarily be representative. Next slide, please. So how can we ensure respondent privacy when administering phone surveys? From our end at IFPRI, we make sure that we have provisions for storing data safely, but what if women aren't in a safe space to answer questions? Before conducting the SEVA survey, and which is actually one of the first surveys phone surveys that if we did anywhere in the world when the pandemic struck. So there were important learnings for us from this survey. So before conducting the Seva survey, we had been forewarned by Seva that several women were unable to answer calls from Seva in private because their phones were on speaker. And this was an important sort of fact for us to know, because we were planning to ask sensitive questions on conflict, and just confirming who women were in a private space or not wasn't enough. So we decided to add a question in our survey to gauge if the phone was on speaker. And this was done both at the beginning and again just before the conflict module was administered, which is the last module in the survey. We obviously could not ask this question directly, right? I mean, if someone is listening in on phone and we ask them, is your phone on speaker? We were not sure if that would give us an adequate sort of measure of whether the phone was on speaker, so we had to modify. And we kind of trained our enumerators to ask this in a casual way, saying that, I hear a little bit of disturbance. Is your phone on speaker? It's totally okay if it is. I just need to change some setting from my side. And most of the subsequent surveys we have done since then, both in the region as well as in other parts of the world, we have included this question in some form or the other. In some countries where our gender surveys were done, survey teams felt that enumerators were able to gauge whether the phone was on speaker just from the way the voice sounded on the phone. And so they made a note of it. Instead of asking this question, they made a note that the phone is on speaker. And that way sensitive questions were automatically excluded from the survey. Just to give you, next slide, please. To give you a sense of how widespread the use of phone surveys was in both the countries, this is from the first round of the survey. I want to add that as sort of we progressed, as rounds went on and the enumerators developed familiarity with the respondents and vice versa, speakerphone use has declined. But this just from the first round, we found widespread speakerphone use in Gujarat. 65% of women and 47% of women in Nepal had their phones on speaker. It's hard to measure what the reason for having phone on speaker could be. I mean, we know from anecdotal evidence in Gujarat that in many cases the phone was on speaker because women had been asked by in-laws to keep their phone on, or by husbands, because there was a general atmosphere of distrust following the lockdown. But there could also just be a cultural reason, which would explain why nearly 40% of the male sample in Nepal also had their phones on speaker. Again, there's no way of knowing, but some of the reasons why we think is that it could be that people answer the phone while they're multitasking, so they keep it on speaker. Sometimes your phone instrument itself might be old, so your voice is clearer if the voice on the other end is clearer if the phone is on speaker. But I also want to point out that this finding is not unique to South Asia, nor is it uniform across countries. In surveys in Africa, we found very high speakerphone use in Senegal and Ghana, more than it was in India, and little to no use of speakerphone in Kenya and Niger. So there is considerable heterogeneity. Next slide, please. I just wanted to give you a sense of how, something as simple as speakerphone use could affect responses to questions that you may not think it would affect. So while the speakerphone was on, like I said, we did not interview women. We did not ask questions on sensitive questions on household conflict and intimate partner violence. So no question on intra-household conflict was asked. But it was clear when we kind of went back to the data that having the phone on speaker even affected answers to otherwise innocuous questions. So just as an example over here, you can see that those women who reported to have their phones on speaker in the beginning of the survey were more likely to report their spouse as being the sole decision maker for their earnings. And in India, they were less likely to report themselves as being the sole decision maker. And this kind of discrepancy in responses kind of tracks even when we look at other responses. And this is just descriptive evidence. This holds even when we do more sort of rigorous analytical analysis using matching and a couple of other bias correction techniques as well. Next slide, please.
We need to wrap up. Sorry for the interruption.
Yeah. Okay. Sorry. I'm just wrapping up. Last slide. So one of the things we did to kind of get over some of these issues that I've highlighted, we ensured that survey teams in both the countries were made up entirely of women. And as far as possible, we tried to make sure that the same women were interviewing the same respondents over the next subsequent sort of rounds of surveys. We think this helped in increasing response rates, especially given that so many women had their phones on speaker and there was an atmosphere of distrust. We made sure that we took enumerators who were familiar with the local cultural context. In Nepal, in Gujarat, it even meant that we made sure that women from a certain district were making up the enumerator team for interviewing women from that district. And this enriched our own understanding and framing of questions, narrowing down options, eliminating superfluous questions, etc. Prior interaction and relationship building is key. So we had, of course, some institutional backing from SEVA in some sense, and prior interaction through the in-person listing exercise in Nepal. So that kept our refusal rate quite low. But as phone surveys become more common and you are trying to do cold calling without any prior sort of interaction with enumerators, that's obviously going to be a challenge. So we were fortunate in that sense. Like other people have also pointed out, at what time you do the survey is key. But again, this is not uniform across, even within the region. So in India, we found that more than 2/3 of our surveys were done between the time period of 12 to 6 p.m. Whereas in Nepal, it was the opposite. Most of our surveys, more than 60% of our surveys was done between 8 a.m. to 2 p.m. And even in Nepal, this changed as we went closer to the paddy harvest season time. There were some issues about dialect in certain areas in Gujarat, and that's why I said having even very sort of hyper localizing where you're recruiting your enumerators from became helpful for us. So again, we need to carefully consider these challenges, especially when trying to reach disadvantaged groups via phones. Especially when serving women, we need to design our survey in such a way that you eliminate the time that is taken. So in the case of interviewing women, we often found that children picked up the phone, especially if it was done during when online classes were being held. So we had to account for those things in the way we designed our surveys, making sure that we called women back. And the amount of times we attempted to call women changed based on what was the reason we were not able to reach the women in the first place. It's always very helpful to supplement surveys with more qualitative work. We've been doing case studies with SEVA members. So this is very, very qualitative in nature, and trying to kind of merge what we are getting from these surveys, which are very quantitative in nature, with these life stories of SEVA members that we are collecting parallelly. And again, tracking these same women over the last 1 year. And just to kind of belabor Divya's point, we have recorded results of our surveys in Hindi for SEVA to share with their district teams. That these are people who are working with SEVA members as well as members themselves, with the hope that there is sort of giving back what information that we are getting from them, as well as to guide relief work by SEVA as the pandemic progresses. Thank you.
Thanks so much, Musna, for a very enriching presentation. Over to you, Vinny. It's really hard to go last, but really looking forward to what you learned from this huge mammoth survey.
No problem at all. I think it is one of the perils of going last that you are always crunched on time, but we'll try and make the best use of this. So if you could go to the next slide. There are two major studies that I'm drawing my findings today from. One on the left that you see is the gender impacts of COVID-19, where we actually surveyed primarily women. So out of the 17,000 sample size that you see, about 15,000 were women and about a dipstick sample of 2,000 men. And on the right-hand side is a study that we did last year, about 12 months ago, where we were trying to see the efficacy of government indictments. That was a much larger study, about 47,000 people, but mostly targeted at households. So those are the two main studies. Beyond these, there are other studies that Darba is also doing on early childhood development, education, and some of the work that my fellow panelists have done. So we have tried to weave in learnings from all of that. On the next slide, you will see that we've jotted down a framework of how we actually think of doing phone surveys. So there are 5 broad questions here that I would want to share with everyone. And these are self-explanatory, so we won't go through each of them. But I think the reason why we've started to think of surveys in this way is that the learnings that we have learned so far are very, very useful, right? And have actually also informed much for our work, right? We regularly engage with findings from other organizations as well as the learnings from our own to actually tailor our service. But quite often it really needs to vary by the topic of the study, right? And when you're doing it, who's the audience, and so on and so forth. So as much as it's about thumb rules and learning from experiences, it's also about almost starting from first principles based on the topic of your study, right? So is it about, is the research really needed? Can we actually reach the target population? If we do reach them, are our data needs actually met through phone calls? How do we actually minimize risk, even if we actually meet the data needs? And then finally, something that we talk a little less about is that does this meet the needs of the policymakers? So on the next slide, you would see that when we did the gender work, we realized that there were almost about 1,300 primary research studies published on the pandemic when this is about 7 or 8 months ago, right? Now, 1,300 is mammoth, right? And then it's a hard question that we have to ask ourselves, which is like, do we really want to do this again, right? If a lot of this is already done, why can't we just build off that and leverage that? And where is really the additionality of this? So we spent a lot of time figuring out what are the large studies, for instance, out there. What are some studies that are really gone deep topically? What have they covered and what they haven't, right? And then sort of figure out, that becomes almost a starting point for us, because in these times, you don't really want to burden the same set of people who are also most pressured for their time and resources. The second bit is that think of non-traditional additionalities as well, right? Quite often the same question is asked, but one learning that we had in our preliminary conversations with policymakers who were our target audience was that they felt that most of these studies were actually fairly small, right? And they often felt that does this actually mean that this is happening with a small pocket of population, or is this actually generally applicable, right? This is why we actually thought of large sample sizes to work with, even if that meant that quite often we had to go broad than shallow, right? So scale, for instance, can itself become an additionality. The second question, which is around can you reach the target population by phone, is something that we have talked about a lot on this survey, and it is hard, right? There's no easy answer for this, right? As in, if women don't have phones, adults and girls don't have phones, it's just simply difficult and hard. You can't do much about it. However, there are some ways of doing it, right? If there are, for instance, niche population or at-risk populations, for instance, transgenders, right? Or migrants, for instance, you can potentially look at partnering with organizations that have access to them, right? So Seva, for instance, is a great example of partnership that Luzna shared. But for instance, Jan Sahas has a huge network, right? About 60,000. Then there's Solidarity Foundation, who works with transgender folks. I would admit that in our own study, we were not able to capture them, but these are pathways that we definitely explored and are viable to take forward. The big thing that learning that I have personally had in all of this is that representativeness is hard, right? As in, no matter how hard we try, and especially like when you compare it with the pre-COVID world in which you could do this face-to-face, go knocking door to door, it's not satisfying enough, right? But at the same time, what is really important is for us to figure out how do we actually interpret our own findings, right? Is it the most conservative estimate, or is it the most optimistic scenario, for instance, that we are trying to portray? In our survey, for instance, on gender impacts of COVID-19, we found that most women that we reached out to actually had their own phones, and quite often smartphones as well. That also correlated with toilet usage and ownership, for example, within the household. That also correlated with pads use, for instance, right? So when we are actually interpreting our findings, then it is upon us to actually figure out whether what we are trying to relay is actually representative of the general, or, for example, a small strata, and then caveat those findings accordingly. And then I think you can always go back to those 1,300 studies, right, that are out there to actually balance what you are saying and offering a point of view that might be potentially something that you may not have been able to capture. So that, I think, was a great learning for us as part of this. On the next slide, you would see that there are questions around on whether the data needs, for instance, can be met through the phone or not. And a lot has been talked about this, right? Which is like domestic violence, contraceptive use, mental health are sort of difficult things to, for example, do, and also put your participant at risk, respondent at risk. There are other simpler things as well, right? For one of the things we wanted to do as part of the gender study was to see at what point are women actually going in and out of the workforce and why, right? Before the lockdown, peak of the lockdown last year, and then say at some time during the low times in September, October, right? And the reasons why doing that. But in a 20-minute survey where you have limited questions, it's really, really hard to actually prod down those on those questions. So we intentionally, despite really wanting to know those answers, we intentionally trimmed those questions. It was simply not possible to do that, right? Then on the fourth question around risk to your respondents, again, much has been covered and I won't go into this, but really the last minute I want to spend on the last bit, which is, does the research really meet the needs of, for example, your target audience? In this case, it was policymakers. What we have learned is that data alone is not enough, right? What we often need is a narrative, which basically means we have to start by understanding what their questions are and not our questions as researchers, for instance. And I'm talking from Dalberg's viewpoint, right? And it varies from who your target audience is. What are their questions? What their worldview is today, right? And what will it actually take to change that worldview, right? And then more importantly, how will they actually absorb the content? We may create great analysis that is 50 slides long, but if they are only consuming content on WhatsApp, which is often the case now, then they're not going to read that deck. So what the biggest learning that we have had is that we often now share 2 to 3 to 4 slides, for instance, on WhatsApp to policymakers, right? With a small sort of message, bite-sized info for them to actually absorb that. And that often works well because that gives us an entryway. And if they're interested, then you get into the longer conversation and so on. We are also now thinking of videos, animations, and so on, because they're much easier to consume, especially in today's times where like having time is sort of the biggest challenge, right? And then I think the last thing that I would say is that if you're really going to take the times of thousands of women and girls in such times, right, to do research, it is our responsibility to make it count, right? And the last answers to that last question are really, really important for us to do that. That's all at my end, and happy to take any questions at this point, Samya. Back to you.
Thanks so much, Vineet. And, I was just thinking, I really wish we had more time, more than an hour, because they're such super interesting discussions and also, I think, excellent questions that are coming, which thanks to all of you, we are trying to answer live. Just a couple of reflections. I hope we have 3 to 4 extra minutes to go over, but it's quite interesting to see how actually partnering with an organization on the ground really helps to, ground truth some of these findings. We were seeing in our own iWeed surveys that when you partner with SEVA, sometimes even the response rate for phone surveys increase because, the Angevans go into the village, ask them, please pick up your phones. This is an organization that's trustworthy, and they're not going to ask you the wrong questions. So I think all of that really helps. I think the representative thing is a very important sort of observation on how representative these are. And I think they were even in our surveys, we've been thinking around, what about the numbers that the women that we don't get because they don't have phone numbers. They might not have phones, but equally, I think the government might not have phone numbers because they're probably not individual beneficiaries in a sense, because most schemes are targeted at the household level, and at the household level you tend to fill in the man's number, so you don't have the phone number availability as well, and I think that's an important constraint. And I think something that's coming up very actively in the Q&A chat box is around probing, because you can't have a long phone survey. It has to be about 20 minutes at max. And you cannot probe because of the cognitive load and mental health issues that, Amu discussed. But equally, you want to ensure them of their privacy that Musna was talking about. And that becomes very important for violence. And how do you capture, Sunita ji had an interesting thing on violence, that how do you capture these issues? How do you capture the fact that women are decision makers, but you can't probe on the phone? There's only so much that you can do. So just quick reflections. Hopefully we have 5 minutes and we don't get cut off. I don't think we will. But let's start, Divya, in the same sequence from you, if you have any final reflections.
Yeah, I just want to underline a few points. One is that, Muzna also had mentioned this, and Amu, is that, the training of the surveyors is really critical. Piloting is really important. And making sure that, somebody asked a question about qualitative phone surveys, and we have actually done some qualitative work on the phone. And for that context in particular, you really need to do even more training, set up the protocols, and, build that rapport. So, building that rapport is really important. The second is that, the topics, you do have to be selective given the short, time that you have. And you do, there are some topics that are more sensitive than others, like violence against women. We were basically told not to collect that data. But I am quite on the fence about that because it means we don't have data on it. So, it is a bit of it is something to think about deeply, is, how can you collect it in a careful way and really like set up the systems where, for example, you understand what's the context, going back to the problem about, a lot of women answering the phone on a speaker phone. You can't ask a question about violence against women when that's the situation. And then finally, Soumya, I know you've asked a lot about the representativeness of these phone surveys. So I think, just kind of getting a sense of these phone numbers before the pandemic helped us, in the sense that, we collected these phone numbers a priori. So we had a sense of who we were missing. And to some extent, I wouldn't say that it's in any way foolproof, but it does give us some confidence, at least in the types of households we are missing and not missing. So that information helps to get a slightly less biased sample, because we're able to, weight the final results accordingly. So I'll stop there.
Thanks, Divya. And Amu, over to you. Any final thoughts?
There was a question on, like, they were saying on qualitative work and prompting, and therefore the cognitive pressures. And I think at iWage, a lot of the qualitative work that we have done, we have actually done it ourselves. We have removed, having to train people, and then, having another intermediary between the researcher and the person who is answering. But even then, what we have found is that in certain times, like a lot of government officials are in office while they are talking about these things. And when you're in office and you have colleagues around, even if you want to talk about palliative issues, it becomes very difficult. So they're asking, I mean, what I have found is what the not having direct prompts. Having prompts that ask as proxies or ask as situational questions that talk about something totally different, but are giving an idea about what we are wanting to get at. What that also does is that it allows them to go into detail and nuance. But if you're talking about, if you just say that, okay, what has been your experience, that might not be the best way to get at the answers that you're looking for. Thank you. I'll end there.
Thanks, Samu. Musna, I think it was really interesting what you and Divya also highlighted about sharing insights from the survey with the respondents themselves. Any final thoughts, reflections overall as well?
Yeah, I just wanted to echo what sort of Divya and Amu have already talked about how to frame the question. I'll share a particular example. So we were very careful when we were framing our questions on intra-household conflict. We made sure we didn't frame it as sort of your own household experience of interpersonal violence, but more sort of, have you noticed this in your community? And we worked with our team members. I'm not an expert on intimate partner violence, but we have a whole team of researchers, a whole division that sort of works on these kind of issues. So we brought them in to help us frame our questions better. The USAID mission in Nepal wanted us to ask questions on child marriage. Again, we could not ask these directly, so we asked about, have you heard of child marriage in your community? And then we were able to triangulate from how many people in a village said yes, they had heard of child marriage, etc. And so sort of framing those questions that way, and the sharing and feedback, yes, we've found that to be extremely helpful. And SEVA has, in fact, as soon as our surveys are done, the first people we share our findings with are SEVA before we even share it with a larger team, because it is helping them respond very quickly to what the issues that are emerging among their members are, because SEVA is doing a lot of relief work since the pandemic has started, and that's really helped. We'd like to hope that, we'd like to believe that our findings have helped them kind of focus on what the issues are. And so, for example, earlier in our surveys, we noticed that food security was an issue, but as time went on, food security became less of an issue. Livelihoods became more an important issue, and that's helped them adapt their relief measures to what we found in our surveys. Yeah.
Thanks so much. Thanks so much, Rosna. Vineet, just any final thoughts? And I think also the issue of representation and some of the final questions that are coming in the Q&A are around partnerships. So once you actually go with a partner organization, are we really, just capturing a particular cohort of women in the community, for example, SEVA members, and those findings be then reflective of, other women in the community who may not be SEVA members, for example?
Yeah, no, very well. I think the way we think of partnerships, and honestly, we are also very early in our journey on this. So we are also learning as big as we go. I think you're absolutely right that the way at least we think of partnership is that when we actually want to oversample a particular segment of population, for instance, third gender folks, right, which you would otherwise, for instance, not get, then we intentionally, for instance, try and work with those communities and get there. For instance, one of the things we failed in our studies is to actually figure out who are the migrants, for instance, and we struggled really hard in actually determining from survey questions if someone was a migrant or not, right? And in those cases, for instance, then becomes helpful to actually work with someone like Rajan Sahas. And again, full disclosure, we haven't actually been able to fully see this through, but definitely are exploring partnerships on the go. I think the other bit that I saw a lot around is probing and around qualitative interviews. So I also wanted to sort of present the flip side of this. So Dalberg also does a lot of human-centered design work. And traditionally in the pre-COVID world, each conversation would be, for instance, in someone's house for 3.5 hours, right? Now, what we have also learned is that the flip side is also true, that people want to share and people want someone to listen to them, right? So if you are able to actually get into a conversation with them, which is not about asking questions, which is quite often the case on a phone survey, right? When you're doing large numbers, which is a whole together different ball game. But you really try and understand the context of like who they are, where they are in their life, children, their issues, their worries, and so on, and invest that first 30 minutes into that time, people do really open up and they are willing to talk to you. Having said that, I don't intend to say that you can still talk about ITV, for instance, on these phone calls. I mean, there are some red lines that at least we haven't still figured out how to cross. But it's not all black and white, as in there are instances where you can actually go really deep, and showing deep empathy upfront can actually open the participant to sharing a lot more information that you need.
Thank you so much, and really valid point about physical versus phone surveys. We wish we could all go back to the physical world and also hopefully have this panel in also physically rather than actually being on our own computers. But really, thank you so much to all of you for joining, including the who attended. This whole video would be posted online, and I think one idea that Global has also sent to us is if we could collect summaries of these presentations, all the people who jointly presented, and I mean, we could try and actually draft something and co-publish, joint listing on what might be the reflections coming from this work. That might actually be useful for everybody as well. So hopefully I'll come back, to all of you offline on that. But the videos would be available. So thank you very much for joining, and thank you so much to all the panelists, especially for sharing really, really rich insights on what's coming up, especially from collecting data from women. Thank you so much, everyone.
Thank you, Soumya.
Thank you.
Bye.
Thank
Bye,
you.
everyone.